Well, good morning, good afternoon, everyone. Thank you for joining us for today's webinar, a One Health perspective on the emergence of well, I'm going to jump over my words today, anaplasmosis in Canada. And my name is Greg Penny, Director of Programs here at the Canadian Public Health Association, and I am moderating today's webinar. Just a quick note for you. We do have some resources posted on the CPHA website that you can take a look at. There's an example on the screen. If you just go to cpha.ca, you can see what we've been adding recently. So for today's webinar, please put your questions in the Q&A part of the icon, and we will ask questions at the end. I'll read the questions out for you. We are recording this webinar and it will be posted to CPHA's YouTube site. And also at the end, you will be sent to a quick 5-minute survey. We would really appreciate you filling that out. Just before I introduce our speakers, I would like to acknowledge that CPHA's office and myself are located on the ancestral unceded territory of the Algonquin Anishinaabe. So to introduce today's speakers, one of our speakers is Cecile Annie-Senslan. Cecile is an associate professor in epidemiology in the Faculty of Veterinary Medicine at the University of Montreal. Her research focuses on the design and evaluation of One Health interventions and programs for surveillance, prevention, and the control of zoonotic and tick-borne diseases. She leads several research projects on tick and tick-borne diseases in Quebec and at the Canadian level, and is principal investigator for the Canadian Lyme Disease Research Network, where she co-leads the Engagement, Education, and Knowledge Translation pillar. Joining Cecile is Catherine Bouchard, who is a veterinary epidemiologist with the Public Health Agency of Canada and an associate professor at the University of Montreal. Her research focuses on elucidating, I scrolled and I shouldn't have, on elucidating the environmental and anthropogenic factors behind the emergence of tick-borne diseases in Canada and on the measures to reduce their impact. Her primary areas of research focus on improving risk models and spatiotemporal modeling, forecasting of tick-borne diseases, optimizing surveillance, developing and assessing the effectiveness of interventions, and advancing public health practice in Canada. Raphaelle Odette Legault completed her doctorate in veterinary medicine at the University of Montreal in 2018. After completing a general internship, she began her career in companion animal medicine and worked in private practice for 3 years. She is currently doing a master's degree in epidemiology at the University of Montreal, where she investigates the eco-epidemiology of anaplasmosis in Quebec by studying the relationship between bacterium, the ticks, and reservoir hosts. And that I will stop speaking and stop sharing and pass it over to our speakers.
Thank you, Greg. We're just going to wait for Raphael to share her screen. Great, excellent. Okay, so thank you for the introduction. Like I said, today we will actually be 3 speakers. First, I'll provide some epidemiological context and explain briefly key factors driving the emergence of anaplasmosis in the country. Afterwards, Cecile will present the added value of One Health surveillance. And finally, most of your time will be spent listening at Raphael, explaining in details her master project in southern Quebec, looking for the competent reservoirs in different rodent species. Next slide. So this is adapted timeline by Lars Eisen and Paddock, published in 2021, of tick-borne pathogens that were recognized as causes of human disease in North America. I just added the yellow maple leaves indicating where the pathogen with detected human cases have been found in Canada. It's from a paper we published in 2019. And yes, maybe you're wondering why yellow maple leaves. It was just to keep it clean. And if you were at the TechNet Symposium, well, yeah, it is a recycled joke. I tend to be green after all. And as you can see, most pathogens detected within the country are transmitted by Ixodes species ticks, and therefore the green ones. And you have a picture of the adult female Ixodes capillaris ticks on your right. Next slide. So the bacteria Anaplasma phagocytophilum is the cause of granulocytic anaplasmosis. Granulocytic anaplasmosis is the second most common disease transmitted by these Ixodes ticks, such as the Ixodes capillaris, but also Ixodes pacificus in the West Coast. It affects various species of animals, such as dogs, cats, horses, and yes, humans. And then it does infect blood granulocyte, and which explain the name. And you have a picture down there where you can see the morilli detected within the granulocytes. In terms of clinical manifestation, non-specific influenza-like symptoms are seen in humans, such as fever, headaches, and muscle ache, mostly. Serious illness can develop if left untreated, but overall, the mortality rate remains relatively low. Next slide. So where should we expect outbreak or cluster of anaplasmosis in the country in the next 5 years? Well, there's actually a surveillance paper that was recently released in 2023 by Christy Wilson and colleague, where they gathered and described in details passive surveillance data, active surveillance data. And what you can take from this paper is that basically the usual suspects are still of concern. So the 5 eastern provinces, Manitoba, Ontario, Quebec, New Brunswick, and Nova Scotia. And of course, under the boreal forest. And these part of these provinces are likely to report higher number of cases in the coming years. Anaplasmosis will be present in region where the black-legged ticks are well established. So therefore, you can see the orange and yellowish area from passive surveillance data. Next slide. And what is driving this emergence? Well, it's no different than for Lyme disease. Temperature, precipitation, seasonal weather can all affect ticks and tick-borne diseases risk. However, it's the general increase in temperature in Canada that is a key factor in that emergence. Warmer temperature will impact and change the vector ticks abundance, better survival, faster development, faster to establish population, and to grow existing population. It will change also their activity in terms of their questing behaviors, their seasonal peak, the duration of their activity within a year, and it will change their geographic range. So warming climates means larger area that were previously unsuitable to tick establishment, becoming now suitable, and tick population reaching higher latitude, therefore. The warmer temperature not only impact ticks, but also animal hosts. So the reservoir hosts, which are the rodents typically, and the reproduction hosts, which are the deers, will be impacted, again, in terms of their abundance, their activity, and their range or their geographical distribution. And finally, the human outdoor activity, the type of activity, the duration of our activity, the shifting month that we play outside, early warm spring, snow cover delay are all impacting how much we will be exposed to these ticks. And from the US experience, the rapid rise of reported anaplasmosis cases was explained by that expanding range of the ticks itself, the increased environmental spread between ticks and the rodents, and the reinforced vigilance or awareness among the public and healthcare professional. And all of these factors are likely to be at play for us in Canada. And on that, I will contain it and let Cécile continue.
Merci, Catherine. So I am going to bring you at a more local level to illustrate how the adoption of a One Health approach can contribute to our understanding of anaplasmosis emergence in the Canadian context. So with our team in Quebec, we work since 2018 in one municipality, the municipality of Bromont, which is located in the Estrie region in Quebec. And we work on a project not related to anaplasmosis, but on Lyme disease prevention, where we test an intervention in the environment to reduce the risk of transmission of Lyme disease to human. So just to locate you a bit, you see on the left where the Estrie region is located, just really southern Quebec near the US border, and with where the red arrow is pointing. So all the really nice map that you see there were computed by Natasha Bowser, a PhD candidate in our team, in a recently published paper in Ticks and Tick-borne Disease Journal, where she tested how well the reported tick exposure predicts Lyme disease incidence at the municipality level. So this is what you see here at the right. A map showing Lyme disease incidence in humans in different municipalities, part of the Estrie region, and on the extreme right, the distribution of the self-reported tick exposure. So you can see the red arrow is pointing toward the Bromont municipality, where Lyme disease incidence is amongst the highest in the Estrie region. And of course, it's also where self-reported tick exposure is amongst the highest, which is not really surprising. So going back to our research project in Bromont, so in the context of this specific study, we collect questing ticks from up to 14 sites 3 times a year since 2019. And so next slide, please. Sorry. Yeah, so going back a bit in time, we are in June 2021, and in our team, we have an informal discussion with one of our clinical pathologists at Université de Montréal, at CHUV, the Centre Hospitalier Universitaire Vétérinaire. So he contacted us because he was observing an unusual number of anaplasmosis cases in dogs and horses, all from the same region in Estrie. And so we started also exploring, and just a few weeks later, one of our good collaborators from the Regional Public Health Office in Estrie also contacted us because they were also observing an increase in the number of human cases in the same region. And this was then identified as a cluster of human cases with 25 confirmed cases from this publication, but I think it was up to 35 cases in the Estrie region for this same year. So the vast majority being located around what you can see in the map, Bromont, the municipality, one municipality with a vast majority of cases. So if you want to know the full story about the human cluster, I invite you to really read this paper by Campo and colleagues published in the CCDR. I will not go into details. Next slide, please. So we add, with our project on Lyme disease prevention, ticks collected during 2019, 2020, and 2021 that we intended to test for Borrelia burgdorferi, the agent of Lyme disease, but not really for anaplasma. So then came this question with this outbreak occurring in this region. We were wondering, can we detect an increase in the prevalence of infection with anaplasma in our ticks in the years preceding this outbreak? So we sent a subsample of ticks collected for the Lyme disease project over 3 years, so a total of 870 ticks divided in these 3 years to the National Microbiology Lab, NML, for testing. And we also collected some Pyromyscus mouse ear biopsies for the Lyme disease project in 2021, because this is the main reservoir of Borrelia in North America. And so we also sent some 59 samples of mouse ear biopsy for Anaplasma testing. So what you can see on the right is a figure showing just the distribution of our study sites across Bromont municipality. And so the one with the more orange dot are the one where we also had mouse biopsies collected. Next slide. And so here are the results. So the answer to this question is definitely yes. So we can see a significant increase in infection prevalence with Anaplasma in ticks in 2020 when compared to 2029. And in 2021, of course. So this is 1 year before the outbreak in human and animal populations. So what you see on the figure at your right, the dark versus the light gray represent the proportion of the different Anaplasma variants found into our samples. And Raphael will explain the differences between those two variants in just a moment. But in dark gray, it really represents what is called the APHE, human active variant, which is the zoonotic strains that cause the disease in the human, while the light gray represents variant 1, which is not zoonotic. So surveillance of pathogens in ticks can really provide an early signal if, of course, we test for the good pathogens, which we were not planning to do, but we did in retrospective. So to us, this really underlined the importance of and the added value of integrated surveillance for tick-borne pathogens in general. So if you want to read the full story, again, there's a paper published in the Canadian Public Health Journal by Jérôme Pelletier as the lead author. So I invite you to go read for the full story there. And just a note about mouse biopsies before giving the floor to Raphael. So we found only 2 samples that were positive for anaplasmosis which is about 3% of the samples that were sent. So this also raised for us the question about who is the main reservoir of anaplasmosis in wildlife in our context. So over to you, Raphael.
Thank you, Cécile and Catherine. So hi, everyone. I'm happy to be here today to talk about my research project for my master in epidemiology. So my project was developed after the outbreak of human and animal cases in southern Quebec to better understand the disease transmission. More specifically, I'm looking for competent reservoir hosts in different animal species. So first, let's talk about the transmission cycle for anaplasmosis before going deeper into our subject. So as we said earlier, anaplasmosis is transmitted by the black-legged tick, which has 4 life stages: egg, larva, nymph, and adult. First stage is the egg that will hatch into a larva. What's important here is that there's no transovariant transmission of the bacterium. So if the female adult has the bacterium, she won't pass it to the egg and the larva. We can then assume that the larva is free from the pathogen. So to get infected, the larva has to bite an infected host, like a reservoir host, like a small rodent, for example, and will continue to keep the bacterium as a nymph and an adult. Both nymph and adult can bite and infect humans, but human cases are mostly caused by nymph bite because they are smaller and they're also more active during spring and early summer. So it means that hosts are really needed to maintain the pathogen's life cycle. So who are these hosts? we know that Anaplasma has been isolated in multiple species worldwide, and that horses, dogs, and cats can be affected by a clinical disease, as well as domestic ruminants in Europe. The bacterium has been detected in small mammals like rodents and insectivores, also in bigger wild mammals like deer, bears, foxes, and raccoons. But there's really limited data in the Canadian context, and our study is the first one looking at reservoir hosts in the country. So like Cecile mentioned, Anaplasma has a great genetic variability with multiple strains. I will talk to you today about the two major strains. The first one is the APHA, human active. It's the zoonotic one, which caused the clinical disease in humans, dogs, and horses. And the second one is the variant 1. We know this variant circulates in deer, and it's not pathogenic for humans. So we don't know a lot about the distribution of the zoonotic human active strain among the mammalian species in Canada and Quebec. But in the United States, we know that this variant circulates mainly in rodents, such as white-footed mice, squirrel, chipmunks, shrews, and voles. So before explaining the methods of the project, I'll explain to you a little bit more how can we consider species to be a good reservoir host. So the host has to be first infested by vector ticks and has to be able to receive the bacterium when bitten by a tick. After, the species has to allow the pathogen survival and multiplication in its organism and be able to transmit this pathogen to a new tick. So in our study, more specifically, we look at the reservoir competence, which is described as the chance that a tick feeding on a particular free-ranging host species will become infected. So this takes into account the prevalence of infection in the species, but also its ability, the ability of the host to transmit the bacterium to immature ticks. So for example, if we capture 10 mice in the woods and we test all the ticks that feed on these mice, how many ticks will be infected in the end? So to be a good competent reservoir host, a species has to have a high prevalence and has to be able to pass the infection to a lot of ticks. And if we want even a more comprehensive understanding of the host's contribution to the infection of vectors in the environment, we can assess the reservoir potential. So the reservoir potential, it takes also into account the level of infestation of the species. So how many ticks take a meal on the species, and also the density of the host in the ecosystem in relation to other species. So if a host has a good reservoir competence, the impact will be greater if there's a lot of ticks that take a meal on this host and if it's really abundant in the ecosystem. So it leads me to the objectives of my research project. So the general objective is to better understand the emergence of human granulocytic anaplasmosis in the Canadian context by studying the relationships between anaplasma, ticks, and host. More specifically, we want to determine in which species of wild small mammals the prevalence of infection of the zoonotic strain is the highest. And we would like also to determine which species of wild small mammals can act as competent reservoir hosts for this human active strain. So I'll explain more about the study. So it's an observational study in southern Quebec in the Estrie region. This study took place during summer 2022 and 2023 in the city of Bromont. We know Bromont is this region is already endemic for Lyme disease and has an established population of black-leg ticks. So we chose 8 peridomestic woodland sites, and the sites were selected according to distant to human cases. So on the map, you can see that the red dots are sites that were less than 3 kilometers from human cases. But all the sites were woodland sites and peridomestic sites, which means those sites were close to houses and population. And why did we choose peridomestic? In fact, according to the study that assessed the characteristics of the Bromont cluster of case by Campo, 88% of the human cases claim to have been exposed around their home. So that's why we wanted to explore a little more this kind of area. So to study rodents, we used live trapping methods for the capture. So first of all, we use smaller Sherman traps during the night to capture mice. You can see them on the left. And we used bigger Havahart traps to capture squirrels and chipmunks during the day. And in those traps, we put, for example, a bait of peanut butter, apple, oat, and also sheep's wool for isolation. And we placed the traps over an area of 150 by 300 meters in the woods for 2 consecutive nights each month for each site. We had 150 Sherman traps and 12 Havahart traps. So, of course, to collect sample of rodents, it's better to have an anesthesia. It's easier. So we use isoflurane vaporizer for anesthesia, and it was really a short duration of maybe 5 to 10 minutes. We had time then to remove the ticks that were feeding on the rodents. We also collected ear punch and blood sampling. The blood sampling, we needed 100 to 200 microliters of blood. It was very challenging to get the right amount of blood in mice because the veins are very small compared to other species. But in general, we were able to have a good data for this species, and we had more mice than other species. I'll show you later the first results. Also, for the sampling, we performed some dragging to collect questing nymph on the same sites. So 2 times per site, we used a white flannel on the leaf to collect the nymph. We performed it in June for the nymphal peak of activity and in August during the larval peak of activity for the ticks. So with all of these samples, we had the chance to have the National Microbiology Lab analyze the data with real-time PCR and genetic strain identification for the sample of rodents and also for the questing nymph. And in our study, we considered a rodent to be positive if he has either a blood positive result or if he transmitted the infection to at least 1 larva, because we were not always able to have both samples on every individual. So now I'll show you the first preliminary results of 2022. So we captured 339 rodents from 9 different species. You can see some pictures on the right. Mostly we captured Peromyscus mice, 236 mice, but also 30 eastern chipmunks and 28 red squirrels. I want to mention that we performed the analysis on rodents that were captured for the first time only, because we didn't want to have repeated measures on the same individuals. So if we look at the prevalence of infection in rodents, I chose to present you the 3 major species with the most data. So only in blood sample, you can see that eastern chipmunks had the highest prevalence of infection with close to 77% compared to around 11% for mice and red squirrels. And if we look at the larva samples, 57% of chipmunks transmitted the infection to at least 1 larva. So when we look, when we combine both samples of blood and larvae, we can see that 66.7% of eastern chipmunks were considered positive, which is significantly different than Peromyscus mice and red squirrels. So that's really interesting. And also considering the strain identification, when we were able to identify the strain, it was always the human active one. So we never found the strain number 1 in rodents. And the results for the questing nymph, the global prevalence of anaplasma in questing nymph was 5.3% in all the sites. And for the positive nymph, 63.6% of those positive ticks were positive for the human active strain. So this strain is dominant in the environment comparing to the strain number 1. So why are chipmunks more infected by anaplasma than other species? So we have a few hypotheses. First of all, they are usually more infested with nymph compared to mice. So in our study, chipmunks had an average of 5.6 nymph per individual compared to 0.37 nymph per mice. So since we know that they get the bacterium from nymph, it could increase the risk of them being infected. Also, chipmunks live longer than mice. For example, 3 to 4 years, and mice can live 6 months to 1 year and a half, 2 years in nature. We also suspect that the immune response to the bacterium could be different, but there's not a lot of information in the literature at the moment. And also another thing is that the abundance of the species in the ecosystem could also be different. So how do these results compare with the literature in the United States? There's been a few studies that tested blood by PCR in chipmunks. And we can see that there's a lot of variability. So going from 4.3 to 88.4 positivity rates. And we know also that in studies in Western USA, even if it's not the same chipmunks, it's the yellow-cheeked chipmunks, and also it's the Ixodes pacificus ticks, they consider the chipmunk to be an important reservoir host for anaplasmosis. And there's been a study in New York State, close to Quebec, that investigated the reservoir competence of the human active strain in many different species. So they found a prevalence of 53% in chipmunks. And they also found that when they analyzed the ticks that fed on chipmunks, that chipmunks transmitted the infection to immature larval ticks at rates close to 7%, which was similar to mice and better than the other species. So, of course, there were some limitations in our study. We did not capture bigger species like raccoons and skunks because the traps were too small, even if we know in some studies that it can be affected by anaplasma. Also, the traps were less suitable for shrews because they live mostly underground. So we have not as much data for this species. Also, I talked to you about the abundance of the species in the ecosystem, but we're not sure we'll have enough data to know really the density of the different species. We're still waiting for the data of year number 2, so maybe, but it's still a question. And also, we did our PCR on feeding larvae, but we know that there's a method that is even more accurate to keep the that is even more accurate to test the ticks is to keep the animals in the laboratory to let the feeding larvae complete their blood meal and then molt into nymph. And then we test the nymph after the molt. So it's more accurate, but it's also more complicated to keep animals in the lab than doing capture-release method on the field. So in conclusion, we can confirm that the zoonotic human active strain of Anaplasma circulates in small mammals population of southern Quebec, and that other rodent species than Peromyscus mice should be considered as potential reservoir hosts for this human active strain. So we hope that the results will help better understand human granulocytic emergence and also guide development of risk management intervention. So there's few studies that are testing intervention on rodents, for example, treatment with acaricides. So the rodents will, for example, eat a bait with acaricide treatment that will kill the ticks on them. So it breaks the transmission cycle, and the goal is to reduce the number of ticks in the environment. So those interventions need to be adapted to the different reservoir hosts. For example, if we have chipmunks, then the bait box needs to be maybe bigger than the one we use for mice. And what are the next steps? We are still waiting of results from summer 2023. And we're currently analyzing more data. We want to develop a reservoir competence index by species to compare them. And also, we want to use statistical models to investigate the factors that influence the infection and the infestation status of rodents. Also, we want to explore results based on the proximity to human case. Like I said, we chose 4 sites close to human case and 4 sites far from human cases. And the first results show that the probability of sampling a positive nymph was 4 times higher at sites close to human cases. So maybe humans that got infected had increased prevalence of infection in nymph close to their environment. So this is something we'd like to explore in the future. So now I'll let Catherine finish the presentation. Thank you.
Thank you, Raphael. And it's just really to conclude, I guess, on the One Health approach that we took, our team, by integrating data from humans, animal, and environment. And the goal is really just to enhance the way we target endemic area for the vector ticks, how we want to optimize or plan better the active surveillance in at-risk area, develop, like what Raphael just mentioned, more targeted intervention depending on the reservoir host for risk management to be efficient, and finally to detect emerging vector-borne diseases in general. So the next step after Raphael's project, because right now she has completed her 2nd year of field study, we're waiting for the lab result, so there's more to come. But basically, we already started, and I think you can hit that button, Raphael. The next step for us is not only to sample the ticks in the environment or the rodent, like what Raphael did in that particular municipality in Bromont. We want to, I guess, spread a bit. So their sampling in Estrie has already occurred this fall in partnership with the Ministry of Fauna in Quebec. We did that actually last weekend with the hunting season starting. Meaning that perhaps ticks or other sample from there are another way to track the emergence of anaplasmosis. This is something we're investigating and looking if it's worth pursuing. So it's a pilot because of the differences between the variants, right? So there's also discussion toward enhanced surveillance for anaplasmosis with partnership with veterinary clinics, again, in order to extend and go beyond the Bromont municipality. And then finally, I just want to mention also that there are initiatives that have already started and that will continue in peri-urban parks in endemic region to monitor better in the next few years. And ticks, rodents, and even deer sampling will be part of the research work we will be conducting. And so the last slide is really to present to you the team. So first, we would like to acknowledge all the partners listed below for financial and or in-kind contribution, all of the logo that you can see. Also some faces of the actual individual who worked on either Raphael's project as part of our master, being in the committee advisor, or also people who were co-author in the paper that Cecile presented. It takes a village, so we are experts from veterinary, epidemiology, ecology, clinical pathology, medicine, public health. We're all working together since that 2021 outbreak in Quebec. And last thing is really to thank the field assistant and coordinator for all of the field work that has been conducted. So thank you for listening to us for this lunch.
That's great. Thank you very much, Catherine, Cecile, and Raphael. I would encourage everyone to use the Q&A to ask questions. We do have one that we'll get started there, and then while people are thinking up questions, and then I can ask some dumb questions in my brain. So the first question actually somebody had asked is, did you test for other pathogens, like any co-infection in ticks or hosts?
I can answer that. Yes, we tested with ear punch the rodents for Lyme disease. And we tested also, we screened the ticks, also the questing nymph for other pathogens, but I don't have all of the results yet for the other pathogens, but it's not really part of the project, but it's more like in a surveillance. We wanted, since we have the ticks, we wanted to know in case there was something else. But yeah, we tested the rodents, and for example, the chipmunks, they were highly infested too with Lyme disease at rates more than 80% of them were also infected with Lyme disease.
Does that include especially the chipmunks that you had mentioned in particular, or was it different? Like, did mice have more prevalence versus chipmunks, or about the same?
They were all heavily infected. More than the difference was not as significant as with, for example, Anaplasma, because we know that Lyme disease is in this area since a longer period of time, and that mice is the more important reservoir host for Lyme disease too. But I was surprised to see that chipmunks were infested at high rates.
I know in my city, chipmunks are everywhere and people love them and feed them. So I can imagine why. I mean, I think people are much more deterred by mice and other rodents versus things that they view as cute. So I don't think that it impacts obviously the rates, but it just your exposure and just the sheer number. Because I know in my neighborhood people feed them, so there tend to be a lot more and more exposure. So, so another question is: has the trend of increasing anaplasmosis been seen across Canada? Are there any other areas more significantly affected, based, I guess, on your research?
You want to take that one, Catherine?
So, well, so it's, I believe, so I referred to the paper by Christy Wilson, and in that paper that was published in CCDR, beginning of summer 2023, there are actually maps of where positive ticks, black-legged ticks, were found for Anaplasma, but also other pathogen up to 2020, if I recall. And you have sort of the map for passive surveillance signal, but also active surveillance signal. So I will just sort of answer that best ways to go look at that. But of course, as the situation evolve, more cases are being reported, anaplasmosis, we can expect that it will become notifiable in pretty much all the provinces as we see the emerging trend. And therefore, it will not only about the environmental risk or sort of the signal from the tick, but also the human cases. We will see that also as part of a bit like what we see for Lyme disease. So the epidemiological risk as well. But right now I cannot share more than what I shared.
Great. Just before I go to the next question, I did have it's something I guess Catherine and Cecile, you touched on early on about people's awareness of Lyme disease in Bromont and the Estrie region. Are people more aware of anaplasmosis now, or did they? I mean, I'm assuming most people have never heard of it, don't understand it, don't know what it is, because all of our focus has been on ticks and Lyme disease. Did you talk to people in that area about anaplasmosis? I can't even say it. About anaplasmosis?
Yeah, I can take this one. So that's a very good question. So in the region, in Estrie, after the outbreak, of course, there was some media coverage, so people got informed, I think. So maybe, but this was very specific to this municipality. At the Canadian level, and again, I'm pointing out to Natasha Bowser's project, because she's really working on how the Canadian population adapt to tick and tick-borne diseases over at the pan-Canadian level. And so she did a pan-Canadian survey where she explored knowledge, awareness, and behavior toward tick protection. And of course, now I compare, for example, to a study that we did 8 years ago. People are very well aware of Lyme disease, but if you look at other pathogens, tick-borne diseases, they are really not aware at all in general. So the level of are much lower. And so as we know that these diseases have interesting differences also in the symptoms that they show, I think this is really a need for the years that will come to raise the awareness of those other diseases that will become, I think, more and more important, unfortunately.
Yeah. So I'm going to move to some of the questions. So a lot of people have said great presentation and great work, but so do you know if there are any difference in behaviors between chipmunks and mice, which could be relevant in terms of periodomestic risk and tick-borne diseases and different number of feeding ticks?
I know that there's some difference in behaviors, like I don't know how to say it in English, but toilettage.
Yeah,
grooming. The grooming behavior is different. I think that maybe chipmunks are better at removing ticks and then mice are. But mice are really living in the area where ticks are, because they're really under the leaves and they're crawling in the woods. Chipmunks, maybe they have a wider range of activity. They can move on a bigger distance, but they are also on the trees where there's less ticks. So those can all affect the infestation level. But we know that mice are more infested with larvae, and chipmunks are usually more infested with nymph. So I don't have a clear answer, but there's different things that I'm not sure yet how they can all affect the prevalence of infection for anaplasma, but those are some things we maybe want to explore in the futures. If we find that chipmunks are really the key reservoir, would like to maybe on future projects try to understand more why it's the case.
Great. So I think it's similar to an earlier question. So will your team be looking at other pathogens like babesis or Fronticella turnisis?
I can also answer this one. So usually, it depends on the project, because sometimes we are restricted by resources in order to test for a wide range of pathogens, but we try more and more to test for a variety of pathogens. So we often test for Babesia macroti. So for the result that we presented for the Bromont region, we found no samples in ticks that were positive for this pathogen. We also test for other Borrelia species and more for some viruses such as Powassan virus. And so for the next step, I think we will also try to keep more the other pathogens included as if we can afford it with our resources, because we are seeing interesting changes in these new ones.
So you had mentioned that the Zodies is expanding as a result of increasing temperatures. Could the recent research showing that anaplasmosis and Borrelia infection help ticks improved cold tolerance could be impacting the expansion of the Zodies also?
Yeah, it's a really good question, and really from the recent literature that I read on this, this is the trend that they are seeing in Sweden or even Belgium areas in Europe, because again, we can compare ourselves because it's in temperate zone. And what they see with the climate change there, it's questing behavior changes in the Ixodes ricinus. That's the tick they have there. But depending on the pathogen that is infecting the tick, it will affect either their questing behavior, making them more resistant to freezing, like anaplasma. That's one of the study. And yeah, so it is of concern to understand that, yeah, it's really dynamic. So with those warmer temperature, with the pathogen interaction within the ticks, then we will see changes in even the patterns of what we expect in terms of their seasonal peak activity, right? So maybe it will extend because of these pathogen tick interaction. So yeah, it's something to keep in mind and study. So it's a good comment. And I think there was a comment in the chat about Ixodes tick. Should we test sample ticks, northern, like in Rouen-Noranda, in, near the boreal forest edge? I believe that this is what we plan to do, in fact, because we're not sure how Ixodes capillaris will survive at the edge of the boreal forest and within boreal forest with those wildfire fire that we are experimenting and that we will probably continue experimenting. We will probably see changes in the suitability of the forest, because even there will be intervention in the forestry industry to mix the forest, right? So to replant with deciduous tree species, meaning that perhaps suitable habitat in what, 10, 20 years will evolve greatly. So field study, again, to understand that are required. And it's part of some project that we plan to do.
That's great. Yeah, I mean, it will be interesting to see that, given the amount of wildfires this last year, especially, and probably in the future, what that impacts in terms of species survival. And yes, we know the temperatures, but also it's changing the environment. So it'll be quite interesting to see how that ecosystem is impacted. So we're all talking about the chipmunks right now. Is there any indication that chipmunks are the main vector of other tick-borne diseases? Now that we've identified that chipmunks are a major vector in this particular case, how could this translate to tick-borne disease control methods?
From what it's in my project, I read a lot about anaplasmosis, of course, but I did not read anything specific about other tick-borne disease and chipmunks. So I cannot say really, but there's maybe not a lot of studies for other pathogens than Lyme and anaplasma for reservoir host. So this is something maybe in the next few years that we'll investigate more. And the second question was for the intervention. If we look at, like I said, intervention that target reservoir host, there's not a lot of different intervention, but for example, if we can try to limit the access of small rodents close to the house, but sometimes it's hard with chipmunks and squirrels because they move freely over the trees and everything. But if we target them with treatments, with the bait box and things like that, we need to increase the size of the boxes so the chipmunks can enter, because right now what we use, it's only mice that can enter the box and take the treatment. And we also need to know what dose is a good dose for chipmunks because they are bigger than mice. So maybe we don't use the same dose of acaricides. So there's many things that would need to be tested in order to develop intervention on chipmunks.
That's great. You know, and well, I know in the urban centers, and this was something that came to mind, is given, you know, the lack of natural predators in the city. So a lot of those rodents will continue to flourish in the cities and finding and with food in abundance. So it'll be, you know, something to monitor.
Yeah, and
so,
in the peri-domestic area, it's close to the houses. So sometimes they feed like me in Montreal, there's a lot of squirrels everywhere, and they feed with our food. So it's could be a problem in the peri-domestic area too.
Okay. So I know this is kind of a very general question, and I don't know if who would have the knowledge of this. Is there how many human cases of anaplasmosis are there in Canada in the last recent years?
Yeah, I don't have the data on my side, except what has been published and the outbreak and the collaborative work we've done with the DSP S3. So unfortunately, I cannot answer that, but I believe it is rising.
The thing is, with anaplasma, we know that there's in Quebec 47 cases in the recent data in 2021. But there's also data for Manitoba. If I remember, it was like 39 cases. But in the recent years, not sure which year it was. But the thing is, since it's not noticeable disease in every province, then we don't have good data for the Canada globally. So it's probably more cases than what we know.
Yeah, it became reportable, for example, in Quebec in 2019, and it's not reportable in all of the provinces. So this is really a factor that is not helping to have a good overview of it. Is it increasing? And if we look at animal data, it's even worse. We have no data of the number of cases over the years.
And somebody just put in the chat that it only became notified on Ontario in July this year. So obviously it's still rolling out. I mean, this kind of leads into this the last two questions I'm going to ask. One, and this is again a Canadian basis. You know, are you aware of or any evidence of the Zodi cephalaris in Saskatchewan, and would they have a higher anaplasmosis prevalence than they see in Manitoba?
And I wish Emily Jenkins would be there, because we had a big TickNet symposium end of October, and you know they share they're looking hard to find a tick, basically. So no, it's not common to spot any Ixodes capillaris ticks there. But I'm gonna say, but in terms of could they even expect high anaplasma prevalence like we see in Manitoba? Well, like I said, not really as of now, because those black-legged ticks are not common. But it's something to look, because if you look at the US map for anaplasmosis, you can see that, you know, Midwestern and Western parts, although it's a lower incidence rate for anaplasmosis, there are cases. So of course, we can look at our neighbors and understand that within, you know, a few numbers of years, we might look alike in terms of the patterns or the incidence rate that we see. And whatever is south from you could be what you could expect in a few decades, I will say. So that's how I want to answer this question.
So a slow-moving train that everyone can see coming, but
yeah,
which is kind of, I guess, appropriate to the prairies where you can see things further off. So just a final question before we wrap up. So would there be any studies or research that compare tick rates in reservoir hosts, the outcome where there is a presence of dead-end hosts in the same environment, the predictor? That's a tough one for the very last question.
I don't know if Catherine or Cecile wants to answer, but if you want to repeat the last part of the question for me, please.
It's in the Q&A. Rafael, if you want to read it.
Okay.
Renee Roberts.
Well, giving
yeah, it's kind of a part of the goal of my study to better understand the population dynamics and the interaction between hosts, because if we understand better which hosts are a good reservoir for anaplasma, and after, if we know what are the different abundance of these hosts in the same environments, if one host is, for example, really not good at transmitting and is really abundant, there could be an effect on the outcome. So we would like to better understand the population dynamics. It's just hard to have good estimate of the density of different species because we don't have enough data for each species. For example, we captured a few shrews, like maybe 10 to 20. It's not a lot to estimate if there's a big proportion of them in the environment. But the goal of my study is really to better understand the reservoir competence, and after we can maybe translate this when we have a good idea of the composition of the host in an environment. So yeah, of course, this is something we'd like to know more about.
Well, thank you, Rafael, Cecile, and Catherine, for your presentation and all the work you're doing, and I guess the work you're doing in the future. Thank you to everyone for joining us today on this webinar. We will be posting it to the YouTube channel and sending the link out to everybody. And just a reminder that our next webinar is November 30th, and on climate change and vector-borne diseases, addressing local climate projections and enhancing surveillance tools. And with that, I wish everyone a good day, and thank you to our presenters. Have a good day, everyone.